Today we are going to talk about how to evaluate the infertile couple. And when the couple walks into our clinic, we generally do certain evaluation. And initially, I meet the couple and I start the history and the examination. Then we'll go into some investigations. So when you call them, if they walk into our clinic or not, everyone will get into all these things. Only if they are having infertility, it should be at least a minimum period of 1 year of trying the pregnancy without using any contraception. And if you fail to conceive, then we can call it as infertility, and then we can go for this evaluation. So in case if you are above 30 years or 35 years, and the duration comes down above 40 years, and then above 40 to 45 years, definitely within 1 or 2 months or premarital. So the evaluation start as it is, when we see the couple, we first take the history, and we have to ask about their medical problems, any allergic, asthmatic history, so that we know certain drugs can be used or not used, and whether they are having regular cycles or not. That will tell us definitely whether they are having a polycystic ovary or hormonal imbalance or not. And certain history, like in between any spotting, bleeding PV is there, or irregular PV and irregular bleeding PV, those things will tell us there is a symptoms of endometriosis. So we have to go for endometriotic evaluation. And some people will have short cycles, or they'll have prolonged amenorrhea. Those cases we have to go for an immediate scan. So once the history is evaluated, and then all the medical reasons are rolled out, in GBR Fertility Centre we go and do basic scan. That is that should be done by the gynecologist who is treating the patient, and the scan will tell us whether the uterus is normal, is there any fibroid or not, and the ovaries, whether they are polycystic or non-polycystic ovary, or they are otherwise they are ovulating or not, we can find out. If they are coming on baseline scan, like day 2 or day 3, we will know the reserve of the ovary, how many follicles they have, how many antral follicles are there. So it will tell us that whether the ovarian reserve is adequate or not, or polycystic ovary also can be diagnosed the best during day 2 or day 3. So if they are coming in the middle of the cycle, then we have to see whether depending on the particular day, whether the ovulation is corresponding or not. If the follicle is growing bigger and it is normal, then along with that endometrial pattern also will be studied, and we can take it as normal. So some patients, if they come before menstruation, that time that a scan may not be that much useful. So only after the cycle they can be re-evaluated through scan. So scan will tell us so many factors, like any tumor in the ovary, tumor in the uterus, or any adhesions, any adnexal mass, that is structures close to the uterus and the sides of the uterus. So those things we can identify, definitely rule out. If you are a good sonologist and a gynecologist, you can definitely make out abnormal findings. And another thing in the scan we can make out is uterine factor. Is there any polyp or fibroid? Whether the blood supply is to the uterus is adequate or not, we can find out. These are the main things which will guide us how to go about our investigations. So after the scan, we will definitely have a counseling session. In that counseling session, we will be able to find out if the system anatomically scan wise normal, then we will be asking about the husband's history. Husband's history, again the work and profession, and the way they are working, and what is their medical problems, and then habits, and any drinking and smoking, all those histories should be elicited. And sexual history also very very important. Is there any problem, or if they have any problem, what kind of problem they have, we have to find out from the main two. So once all these histories are evaluated, we will come to know almost with the history and scan, we can make 50 to 60% of the diagnosis without doing any blood test. Once we come into this diagnosis, then we can go for a basic semen analysis. analysis will tell us it should be done properly in the fertility center, not like any other laboratory test, like where you can go and do some sugar test or blood test. It should be done in a fertility center where they have an embryologist and then IVF lab. So in that setup they can have a good microscope, and also evaluation will be better, and that will guide us how to go about our treatment. And once the count is normal, then we can go for the female evaluation alone. If the sperm is abnormal, then our andrologist will take over and then evaluate whether they can be treated with medically or any other surgical procedure can be done. If the sperm is very poor, they can go through a surgical extraction also and go for a IVF and ICSI. Once we see the women, their scan, and then we have to go for the men. Men evaluation starts by taking an history. Proper history is very important, because their lifestyle we have to know, their work and profession we have to know, and what are the hours they are working, and what kind of shift they are doing. All these things are important nowadays, because sleep and shift alters a lot of sperm factors, and also their habits like alcohol, smoking and tobacco chewing. All those history is important, and whether they have any medical illness like diabetes, hypertension and hypothyroid and some other medical disorders. If they are on that drug, then we should know that the drug effect on the sperms. So all those history should be taken care. And next comes the sexual history. In them, like if they have any problem with this sexual problems, physical or psychological, it should be evaluated by the andrologist. So they should tell what kind of problem they have, how long they have, and whether it is more of any medically related or psychological related. So depending on that, the counseling should be given. So this history should be elicited. Then we can go and do a basic semen analysis. If they have a already existing medical disorder or aged men, then we have to go for along with the DNA fragmentation index to know that the sperm damage is there already or not. So poor morphology also tells us that already some kind of sperm damage is happening, or stress-induced sperm defect is happening. So we should make sure the morphology is good, not only the count. The morphology is very important, and also DNA fragmentation index in cases of abnormal sperms. And some men, like what is the basic parameters we are looking at it. If you are doing the semen test in the first time, you have to come with a prepared of 2 to 3 days of abstinence. You should not take any antibiotics. There should not be any fever, cold or any illness in the past, recent past. And if you come prepared, you should understand how you have to collect, and you should be collected in a wide mouth container. You should not spill, and you should collect all the sperm together and then hand it over within 30 to 45 minutes. And it is better to collect by masturbation and give it to the lab within the hospital. Or if you are collecting from the home, then you have to make sure all these things are taken care, and also it is handed over within 30 minutes of time, so that the liquefaction starts after 30 minutes. Then we will be able to count the sperm. And mainly sperm count is analyzed, and motility also is analyzed, and apart from that, as I said, morphology is separately analyzed. So all these three parameters are within the WHO criteria, then we don't need to worry about that. As I already told, that if they have existing medical problem, they are all on drugs, and all after so many failures, if they are coming, they should go for detailed extended sperm evaluation. In case they are above 45 years, DNA fragmentation is very important. So this is how that men is taken care. If they have a sexual problem, then we will be asking our andrologist to do the examination and do a counseling, and he will be taking care of this other aspect of their problems. And once we do this basic test for the women, what we are going to do after the scan, we are going to do certain basic tests like hormone test that is done on baseline, second day or third day. Sometimes even the day one can be done. So within first 3 days, we will know that exact hormonal values of their body, whether they are balanced or not balanced, whether the LH is normal or not. Prolactin level should be tested. So if the hormone profile is normal, then we can go for normal or any treatment kind of protocols. Without doing a baseline hormone, if you are going about it tomorrow, even if she conceives, sometimes the miscarriage rates are very high if the LH is not taken care. If the prolactin is high, again the pregnancy rates are very low. And apart from this hormonal test, basic hemoglobin, thyroid test should be done in fasting, and the screening should be done. So viral screening should be done, so that when we are using this thing, any pre-existing viral illness also we should treat them or protect them. And next level is to prevent recurrent abortions or any reasons for abnormal children. Miscarriage rates, to reduce the miscarriage rate, we should do basic rubella screening should be done. In GBR Fertility Centre, rubella screening is done as a routine, because we are seeing more and more people are having less antibodies or non-protective rubella IgG antibodies, and they are going for miscarriage or missed abortions. So to prevent that, better to give them a vaccine if they are not protected, and then go for the pregnancy planning. So once the basic evaluation is done, if everything is fine, and the tube test is the invasive procedure. If they are having a regular cycle, we will monitor a ovulation period and we will ask them to go for a natural cycle. If they are having irregular cycles, then and also polycystic ovary, we give them a course of medicines from the day 2 to day 6, and then ask them to come for a day 8 scan. If the injections are required or not, we will decide based on the follicular study. If the follicular study is okay, the follicle is growing exactly as expected, then we can go ahead only with the medicines, and we can see ovulation and document ovulation. Once ovulation has happened, we can ask them to have a timed intercourse. So this is how the 1 or 2 cycles can be tried. In case if the ovulation is not happening or follicle growth is not adequate, we can add injections like FSH and HMG injections are there. These kind of injections can be added, and if you know the response was poor, we can start from the beginning. If the response was not good, then we have to additionally add higher kind of injections. Then make sure that she ovulates. So this is how it is taken care. So 1 or 2 cycles without injections, if you are going through this follicular study and ovulation is documented, still if you are not getting pregnant, we have to go for tubal evaluation. So the tubal patency can be tested in 2 ways. One is by doing an X-ray if they are only trying for few months, and then they are coming for first time evaluation, we can do an X-ray, that is HSG, hysterosalpingogram. Or we can do by laparoscopy if they are married for more than 3 years and already some problems are encountered, or in the scan shows some abnormality, we can definitely go for a laparoscopy in the beginning. So X-ray will tell us, X-ray is just injecting a dye into the uterus and taking a film. And this will tell us about 2 factors. One is the uterine factor, second one is tubal factor. So uterine factor can be by birth defect, uterus can be single or half of the uterus or double uterus. So these abnormalities can be find out, either septum is there or not, we can find out. And the tubal status, whether the tubes are blocked or not, or what site of the block can be identified. Sometimes this X-ray will tell us that if the tubal sterilization done, those patients or patients who had ectopic surgery, it will tell us exactly where is that surgery done and how far the tube length is there. We can identify these factors and plan for a further surgery. So this is how X-ray is done. X-ray is a small procedure, but it is a little painful, but it should be given, some medications are given before the procedure, so it will alleviate the pain. Next one is laparoscopy. Laparoscopy is a more of a surgical procedure and it is done under anesthesia, and we will be discussing this in detail in some other talk. And this is the tubal evaluation. Once the tube is done, the tube is alright, then definitely we can relax and we can go for this ovulation induction for 1 or 2 cycles. If ovulation is established, count is normal, tube is fine, all these factors tells us that there is not much major problem, then we can try 2 or 3 natural cycles or ovulatory cycle with a follicular monitoring. If these things are failing, then after 2 or 3 cycles we have to re-evaluate. So re-evaluate the history, re-evaluate the scan findings, and then also the blood parameters. So all 3 things are again, if they look same, then we can try out on IUI, that is intrauterine insemination. That is the first level of treatment we can start with. So far what we have discussed is an overall guidance, and it is a basic necessary steps what we do at our center, and this is not a fixed protocol, because individual patients are different and depends on the age, duration, the problem they have and previous treatment history. Depending on that, this evaluation may vary individually. That is why we keep on saying that personalization is very important. So individualization of treatment is important. For that, even the evaluation starts with the doctor. So the moment we see you and examine and come to a clinical diagnosis, the further investigation evaluation will be carried out in a different fashion. So we have to go through. Definitely first step you have to do is to choose a proper fertility center and a proper doctor. So once you have done that, then the rest of the things goes very smoothly, and I hope everyone will understand these steps and procedure. In subsequent episodes we can talk detail about each and every test. Thank you.